Okay, so I'm going to actually, I just pressed record, so I'm going to recap what I just said. Your question is about cord prolapse. And so I'm clarifying that cord prolapse also is known as cord presentation because it becomes the presenting part. Either it's a head presenting or the feet presenting or the butt presenting. In this case, it's the cord presenting. So, and it depends when this cord can wash down. So for instance, of course, for it to come, it can occur during ruptured membranes, where at this point it can wash down suddenly. If the baby's high or if the baby's in a breech position, potentially when the bags rupture with sometimes they can rupture with a rush. Potentially the cord can wash out as well. And not
rupture membrane, it means that the membrane may break.
The amniotic sac, the sac that the baby's in. So that they refer to it as rupture of membranes, or the sac is called a membrane in short sometimes, often. So these are some situations where it can occur, where you might, you look for it. So the concern being is that as the baby descends into the pelvis, and as the cervix opens up, that the baby starts to pinch off the umbilical cord, and this means it cuts off supply of oxygen and nutrients to the baby. So this is when this occurs. Yes, it is of concern. And it doesn't happen often, but it did happen not so long ago in Mayapur. And Gauri actually was the one who attended this birth. So it's attending such a situation at home is quite different from attending such a situation in the hospital. I look forward to Tapasya joining us, so if she can give me her input into this.
Okay.
I'd like to hear from Gauri now, years later. I always kind of tease her that she saved me, all these kind of unpleasant, difficult births that occurred in Mayapur. Often I was supposed to be the midwife, and something occurred and Gauri just kind of swept in, and she had to contend with these difficult situations, and I got saved. Anyway, yeah. So
this situation happen only in the hospitals. Is there any possibility in the normal births too?
In hospital, generally speaking, they don't give, they just take you straight off to theater and perform a cesarean. I highly doubt in this day and age that any hospital will do anything different to that. At home, okay, at home, it depends what the situation you are faced with in the moment. So if you have a baby that is high, and the cervix isn't fully dilated, and let's say the baby was high for whatever reason, perhaps the baby was breech, perhaps the baby just was high. Bags rupture with a splash, and out washes the umbilical cord, and maybe mother's only 6 or 7 centimeters dilated, or 8 centimeters dilated. Okay, this is as best as I think you can do. Ooh, and this is interesting. Um, this will be in. Last week we were talking about precipitous labors, and um, how to be calm and hi Suvarna, good morning. and
Sorry for the disturbance.
and so we're telling I do not appreciate, many of us don't appreciate the approach of yelling at a woman, intimidating a woman, uh, that kind of thing where you're bullying her into submission. You've got to deal with this now, or your baby's at risk, your baby's going to die, this kind of thing. Good morning, Kavita. Very
Good
nice to see
morning,
you.
dear. Good morning. Sorry for coming late.
No problem at all.
Thank you.
So that without taking on that type of bully tone. So in this case, and I've had situations like this before where, yeah, listen, I need you to have your baby. I don't, recently I was told of a story where a nurse is yelling, it's up to you now. The life of your baby is in your hands. You have to, you have to have your baby now. Um, it's kind of threatening that if you don't do this now, your baby will die. And so we brought that up and meant I do not kind of like that angle. I don't appreciate that mood. So let's say in this situation with the cord prolapse, if the cord washes out and we are in a critical situation. So I did mention I'd like to hear from you. We're talking about cord prolapse, and in this case, I'm just throwing out scenarios. But Nirosha has asked this question while we were waiting. And so I'm just kind of giving a scenario where one would be concerned, and I'm just starting off while I was waiting. So, and I was thinking, gee, I wonder what you would do. So as an example, let's say the woman's 7 centimeters or something, the baby's high, cord washes out. Narosha didn't really understand. I'm just giving her a rundown of what it is and an example of what we've experienced. Or why it can be an example of a situation where this would be serious. So if the baby's high, it comes, but cord washes down, baby descends, and the concern will be as the baby descends, he'll pinch off the cord and then yada, yada, yada. So when I've had situations, and I've said to this woman, listen, this is a situation. I need you to have your baby now. Can you do that for me?
Yeah.
Can you get in? Something like this, I throw it to her and I let her know, I need you to have your baby now. So that is something I would throw if I was at home. That is something I would throw at the woman, I need you, and I was concerned, and I can see an imminent problem. That is what I would say. Um, Tapasi, can you still not hear me? You must have heard me say something.
I can hear you.
Yeah. And Gori, I mentioned before, okay, good. If you were so I value your purity, if I may say. So in this, if you had a situation like this, is a cord prolapse, and baby was looking iffy. Wait a minute. Okay, you have a cord prolapse. What next? I just want to, I'll wait for you. You may not have that, but anyway, these are the concerns, and the way we've dealt with it before. I'll go on to it because Gori's not here. Yes. Put the mom's hips in the air and transport. Indeed. Okay, so this is what you would do. You would do nothing. Okay, yep, standard. This is the standard response to the cord prolapse. And this is indeed what Gori had to do. And what occurred was, unfortunately, there was no elevator and there was only stairs. And I think it was the third floor. So as I understand it, the mother had to walk down on her hands and feet to get down the stairs. And then they got her into a taxi, and off she went, and a cesarean's there at the end. Okay, so it is possible indeed. So Tapasya writes, my teacher has seen one, but it resolved itself and the baby came out normally. So I would assume what happened is the baby came out quickly thereafter. So, so indeed, if the mother is fully dilated, the baby is low, and she's got full good pushing urges, and you're at home, bang, this is what happens. Baby is coming anyway. Good. But baby has to come fast. And indeed, you also need to weigh up your options in this point, because it can take you longer to get to the hospital than it is for you to push this baby out. If the mother has had many children before, some children before, if she, you know that she can push the baby out quickly, then we can you can give it a go, and it can occur. But if the baby's high and you don't see that as happening imminently, I really don't know of any other option. Imminently meaning that the baby will come quickly. Once the baby starts descending into that pelvis, you can't afford for them to linger. They have to go into the pelvis and out of that pelvis because they're pinching off that cord. So if they can't do that, knee chest position and to the hospital. And in the hospital, they will do a cesarean. And not good thing cesareans around sometimes. Okay, so the topic of the day was oligohydramnios, which, to be honest, I don't have a lot to. Yes, it is rare. Okay, cord prolapse is rare, but it does happen, and it is something that whenever you have a ruptured membrane that happens with a gush, it's kind of okay. It's usually standard for a midwife or home birth practice to check and see because the concern is with a gush that the cord can wash out. And so you may look, you may not either, but you would, certainly have a look or let them have a feel, see if and they usually, if it washes out, they feel it. But yes, rare. But if you have if you have a breach, it's more likely to it can occur with a gushed membrane rupture. But then if it goes, the other thing is, if it goes between the legs, you might be able to splint it, huh? And take the pressure off it. Yep. Yep. Most times this is the case. Most times the posterites, one of her mentors had it because she had an artificial rupture membrane at the hospital and had to undergo a C-section. Again, another reason why really artificial rupture membranes really aren't recommended, and not just by me, but the World Health Organization. That was their recommendation was avoid it. It doesn't usually cause it opens up to more problems than solves. Okay. If Gori comes on, maybe I'll get her to cover that story of hers. I wouldn't mind hearing it again too. Okay, so Polly Ollie. Okay, so there you go. Polyhydramnios. Yes. One of the issues of polyhydramnios is you can have a big rupture. When you have a rupture of membranes, it can wash down the umbilical cord. Is that why you brought it up in relationship to this, Narosha? So yes, this can be an issue. The other, but I personally don't deal, again, for me, my thing is, if it's not broken, don't fix it. So is there a problem with either the hydramnioses? Maybe. So for polyhydramnios, it could be some congenital disorder or something like this. And this is just a discussion you have with your parents. I personally am not up to date with what they're saying in 2021. What would be my normal routine if I came across something that was unusual, if a woman started to present with polyhydramnios? Then next thing I do is I start looking up polyhydramnios and start, updating my brain. And then I'd sit down with the mother and have a talk with her and explain things to her. And it depends. Like, for instance, maybe she already knows that, okay, I did have a woman who did know something was wrong with her child. It was diagnosed early on. But as a religious person, she kept the pregnancy, knowing that the child would not survive long. So of the consequences was polyhydramnios, and so there was nothing really further to discuss about it, that the mother didn't all, it was all part and parcel, the whole package. But it might be something that if it presents itself later on, as you're checking with the mother, I would sit down and discuss it with her. I'd look it up and then discuss it with her. And then she'd guide me as to what we do next. So for instance, she may choose to have an ultrasound. Okay. So then we go and see our hopefully friendly doctor. And if you have a good contact with a good doctor, then you can, they can get an ultrasound for you without heavying out the parents. without intimidating the parents. So actually, now that I think of it, I did have a situation like this. Maybe you can hear me better now. I think I just pushed this in better. Um, I mentioned it before, a baby who died in the uterus. And I do believe it's that the baby was measuring high for a while again, and fluid. They're not just measuring high as either. It's, you can have a big fundal height and have all baby. But in this case, you've got a high fundal height and hard to find your baby because there's a lot of fluid there. So in this case, eventually the baby did die. She did get her ultrasound oops, I'm going to stop that. Hang on 1 second so this doesn't happen again. And we continued at home. It was part and parcel of the discussion. And other than that, again, I'm sorry if I tend to stutter as I start thinking and trying to piece my responses together. That's my only real experiences of hands-on myself with dealing with the situations. For Polly. Now, oligo. This is not having enough fluid. And this can be different. So first thing you look at when in this situation, when you go and feel the baby, you can find everything in the baby. Baby's movements are quite visible. Oh, okay. I think this was Shruti's discussion topic too. Yeah, I think this is your topic, Shruti. So I'm just.
Yes, sorry, I got a bit delayed.
No worries. I just kind of discussed oligohydramnios.
Okay.
And for me personally, I don't have too much of value to offer in experience, other than what stories I've told before. But what I can say is, if it comes across my table, like anything like this, I would sit down. First thing is I'd update myself quickly on the topic. Find out what recent things were there, and just refresh my brain, and then be sure to sit down and discuss it with the mother, and see what she has to say. So some of the things that part of my training, my not online was before the internet, but part of my training, becoming a home birth midwife, I had to research and write pamphlets for mothers. So polyhydramnios was one of the pamphlets, information packs that I had to write, as an assignment. And so what I would do is I researched it and had my references and the pros and cons. And for me as a home birth midwife, it's very important for me. I feel very strongly that it's really I want to educate and inform the mothers, and it's really up to them to make their decisions. I think they're the best people. I think they know. I think they intrinsically just know the answer, and really all they need is some education or whatever. Just throw it out there. And anyway, so I do this. I give these information packets, and then they talk it, they read it, they discuss it. Then we get back together, we discuss it, and the parents lead me in the direction of what they want to do about it. Do they want to have an ultrasound? Do they not want to have an ultrasound? How do I feel about that? Actually, I didn't say that, but how do I feel about that? Oh, hang on. Let me stop them. Right. Yep.
Is polyhydramnios something you wouldn't take up as a home birth, or you would still give it a
I still,
chance?
I would work through it. Again, for me, if it's not a problem, don't fix it. So is that you, Tapasya? Did somebody say something?
Yeah.
Yeah.
No, I just said, I don't want to interrupt you. Please go on. But yeah, I have a story to tell.
Okay. Well, go ahead, because I think I've already kind of said this story. I don't really, yeah, I've already kind of said my story.
Yeah.
Go.
Now, when this topic came up, I just quickly looked through the Understanding Diagnostic Test by Anne Frey. And polyhydramnios, the definition is not very clear, but still AFI above 25 will be diagnosed as polyhydramnios. And often there is a genetic reason. Other reasons are pre-existing diabetes and uncontrolled gestational diabetes. That is also have a link with polyhydramnios. So the best advice to the mom would be take a protein-rich diet, low in carbs, and do her exercises regularly, yoga, whatever she's doing. She was not my client, but an acquaintance. Her AFI levels were 26 at 36 weeks onwards, and that is something not normal. But her doctor was not that concerned. Her doctor gave it a go, and she went into labor at 36 weeks, 5 days, exactly 37 weeks, and the baby was born vaginally with like no problem because the baby engaged in labor. So you can't really predict if the baby will engage or not until the labor starts. That is the first thing, even with polyhydramnios or in absence of it. And that's what our doctors are not ready to wait to baby to engage. At 40 weeks, if the baby is high, they tell the mother that your baby is not going to descend and have a C-section, which is not a good thing to do. But in this case, the baby descended and she had her baby normally, vaginally. And yeah, as you said, that polyhydramnios does not have to be a problem all the time. Like sometimes when it is genetical, it's most probably that the baby won't survive because, yeah, because labor is a big stress on baby, and the bodies that cannot take that stress don't survive. But sometimes we don't understand that, and we try to save uh, babies with problem, and then we have more problems for the parents. Sometimes they are okay with letting the baby pass away if that was the destiny, but yeah, but we know what the problem is with medical system. They want to save everyone, and in that effort they just yeah. So yeah, this is what I know about polyhydramnios, that and again, those AFI level, the pocket method of measuring the AFI, they are erroneous. We have to take into consideration that not every measurement is accurate about that scan. Maybe a couple of maybe a scan by a very experienced sonographer will give you a good idea. But again, you don't have to be scared only because your AFI levels is a little high. That's what you will assure your mom. You will discuss your options with her. Yes, cord prolapse is a risk, but not necessarily it will happen every time. And not necessarily that the poly mom will have a have a release of waters with a gush. she can leak and the baby would be perfectly fine, as happened in this case with my mom. So yeah, that's what I know about poly. About oligo, most of the times, 80% of the times, I have seen it's overdiagnosed. I have seen a mom with levels 4 delivering normally. Uh, the baby was almost dry, not much water came out, but baby was fine. A 3 kg baby crying loud. I didn't see a problem. Yeah, yeah, that's what I'll say.
Okay, so with the polyhydramnios, so yes, the example I was going to use is this, well, and then actually, then I remembered another one. Both, yes, congenital issues. Anencephaly, one was anencephaly, and one actually was a true knot in the cord. That's what we saw. But somehow or other, it put stress somewhere. Somehow or other, there was amniotic fluid. It was a bit more. But really, as with the first one, what presented the real question, not the first one, the second one, the real thing that came to our attention was the fact that it was measuring large, but eventually he stopped moving. So it wasn't, because I don't send people off for ultrasounds. I don't do routine ultrasounds. So it's not like I don't have these columns. I don't have these measurements. I have my hands. I do, I have a tape measure, but that's just a tape measure and it gives you a measurement, but it doesn't tell you why it's that measurement. It just says it's this big. Is it that big because the baby's big, the baby's little, the baby's high in the pelvis, the baby's low in the pelvis, you got the dates wrong? Many, it doesn't mean anything. It's just you can fill in a box. You fill in that box. The first one, yes, was anencephaly. This baby was not going to survive. They decided to birth at home. Whatever happens, happens. So they know this. Whatever happens, happens. They knew this baby was going to die. And as I say, in these situations that are tricky like this, it's good to have a friendly doctor who can be there to help back you up and support you with paperwork sometimes. You are going to end up with, there will be a body, depending where you live, there's going to be, there will be a body. And depending where you live, responses can be different or issues can be different, legalities can be different. Shruti, so from polyhydramnios, is there anything else you want to add to that? And Tapasya, I'll also say and back you up with, in my information pamphlet, much of my info, I would definitely, I like Anne Fry. I like her a lot. So I use her stuff a bit. And Susan Weed, I like them. And I like flower essences too.
Me too.
So, Shruti,
I don't
yes.
have a lot to add, but I do know a couple of cases that was treated with homeopathy, and the polyhydramnios was resolved. In one of the case, the baby had hydrocephalus as well. So maybe that's why she had the polyhydramnios, but that resolved, and the baby was born, and they had to do a surgery for the baby, but then the baby is doing okay after that.
Mm-hmm.
That's
Okay.
the story I know. I see more of oligo actually, which is what I wanted to discuss. Because
Okay. Yep. That makes more sense.
diagnosed or what are we, exactly doing with it? Because I also see a lot of fluid overload because mothers are asked to take a lot of water if they
Yeah.
are, said that you are oligo. The doctor will say have like 3 to 4 liters of water in a day and things like that, and that eventually leads to sometimes edema, sometimes other issues. This happened last week. I had a client who put on 7 kgs in a week, and she was putting consistently 7 kgs for the past 3 or 4 weeks, and the doctor was very concerned. So all her blood work was normal, everything was normal, and she was just bloating. And I spoke to her at length, and I just passingly asked her, "How much water do you drink in a day?" She said, "I drink around 6 liters of water." And that in a weather like Mumbai, which is not dry, which is very humid, and it's winter here, it's not summer that you're going to dehydrate yourself if you don't drink. And I said, "Why? Like, are you that thirsty?" She said, "No, I just drink because I feel my baby should not have less water, so I just drink." And just by asking her to reduce her water intake, I asked her to stop coconut water because what I've observed is in some people, those who are sensitive, coconut water causes hyperkalemia or excess potassium, and that can also cause this water retention for some people. So I asked her to stop that. I asked her to reduce her water intake to like 2 liters. I said, if you're not thirsty, you're not drinking. That's it. And after a week, she said that her weight gain had come down. So she was gaining like barely a kg since we last spoke. That's what she had told me. So this was something very interesting I found, because the moment the doctor feels that AFI is 9 or below, they put them on arginine supplements and lot of water. So, and this is one story. The second story was a mother had oligohydramnios, and towards the end, she went into PIH. And after the baby was born, it had to be a cesarean, but after the baby was born, she ended up having fluid in her lungs. So it was again eddy matters and all of that. So I just wanted to know if you guys have any experiences of fluid overload after, consuming too much of it because you have oligohydramnios. I don't know how that thing works.
Can you repeat the last story you said? How did it end up?
Yeah, so she, after the cesarean, she ended up having a pulmonary
Minutes.
edema.
Yep.
So, and she went into distress, and they had to admit her to the ICU, do the emergency procedures and all of that. So that again, perhaps that could be a complication of PIH as well. But yeah, so this is something that I do see way too often. Like in the past 6 months, I would have seen at least 10 to 15 women with diagnosed with oligo, and they might have AFI 8 or 9, or even then they have said you are oligo, you start taking arginine sachets and arginine supplements and drink a lot of water. Like almost all women are put with arginine supplements, especially after 28, 30 weeks.
So, okay, what makes them say that the women have oligo?
Um, Usually the ultrasound, if the AFI is less than 9, I have observed that this is what they tell the women. Some doctors are a little lenient and they wait till the AFI is down to 7 or 6, but they usually don't wait. At 9, they say that you need to start supplementing so that it doesn't go below that.
So, do you, Shruti, in these, have you been able to? Okay, for me, again, I don't work with ultrasounds. So for me to answer that, I actually have my hands. Um,
Hmm.
I, so I'm feeling a uterus. So as I feel this, what I'm feeling is I can feel a lot of baby. I can feel that there's no water around the baby, and everything I'm touching is baby. So I'm not sure if the ultrasounds are actually diagnosing the same thing are defining the same thing as I, you know what I mean? Because even in my time, they didn't really talk about, I think, again, they're adding more terminology to the ultrasounds in these tests that weren't there before.
Right.
So for me, I'm dealing with what I feel. So then the next thing I'm looking at is many things. Yeah, do you need to drink? That can be the issue right there in terms of oligo. Do you need to drink more fluids? Is it very hot? Are you sweating? Um, so this can be a simple way. Just increase your fluids. You can. We discussed the electrolytes drinks before, and we discussed coconut water before. Um, and now you're bringing up the concerns with the coconut water for the oligo or the polyhydramnios?
For oligo.
For oligo. Okay, so you can put that one aside. But that would be my first thing, right? Meaning I do it by steps. So, but at the same, I talk about drinking. At the same time, I talk to them. What's going on? What's happening? What's your life like? So some meaning, I mean, that's kind of a funny way of talking. I be a little more friendly about it. But the point being is I'm trying to discover if there's any stress, undue stress and pressure on the woman's life. So if this is the case, sometimes you will, the stress can create these situations. So we can address it in that way. But there, to be clear too, that really is, if there's no such thing as they say, a dry birth. The healthy uh, placenta and amniotic sac will produce the amniotic fluid. Generally at 1.5 liters a day, it should be producing this. And the baby contributes by drinking and peeing back into it. So the cycle's going there. The concern you have is if that's not happening, is there something wrong with the baby? So this is, again, a discussion you'd sit down with the parents and you'd have with them. First, we'd be looking at, do you need to increase your fluids? We start with the small stuff and work, or eliminate, just work through the small stuff before we go straight to the dramatic. Your baby's got some kidney disease. And again, I'd be going back to Anne Fry and looking it up and talking to the mother, and if she wishes, we can schedule to have an ultrasound and see what we go to with that. Yeah. And I don't think I have much more to add to that. I mean, I've attended births that would have been technically considered oligo, but we had them and the baby was okay. You just kept hydrating the mother, Again, I keep an eye on vitals, right? You're looking at the high blood pressure, and I'm doing a urinalysis, just a dipstick. I'm checking for glucose. I'm just checking for protein. I'm checking for blood, nitrates. I'm checking for stuff, and trying to keep myself comfortable. Listening to the baby's heartbeat and seeing how he's handling it. So some of the concerns with oligo, again, is there a problem? Well, what are the real problems here? If you've got a baby with a kidney problem, is that going to make him more stressed for labor? Let's find out. Give him a chance, I would say. If he's too stressed, go ahead, go to the hospital then, go get your Caesar. But give him a chance. The other issue, if you don't, the water is there to help cushion the babies, the umbilical cord and the head and things like that. So they have a concern that with the contractions that it'll put pressure on the umbilical cord and so on and so forth. Okay, well, let's see. My attitude would be, okay, let's see. You know, again, I'm not going to rush off to a hospital because something might happen. Chances are it'll be okay. Dun, dun, dun.
A midwife once told me, so I don't know if you know Vijaya Krishnan. So she has her birth center in Hyderabad. And in one of her lectures, she was telling me, I had a birth in which the AFI was 0. And it was a it was a natural birth. I mean, we could do it. So she was saying, it's never completely dry. There is still amniotic fluid inside, and it's just not coming up on the ultrasounds probably.
Yeah, yeah. So Shruti, have you okay, well, I guess what not my concern, but my question or confusion, let's say, is what are you actually seeing? Or do you actually see oligo? Or are you just seeing fears of oligo or are you only seeing diagnoses of
Diag-
oligo or are you actually seeing it?
yeah, diagnosis oligo and giving them preemptive treatment even without actually becoming really very low, like 4 or 3 or 2. I have not seen them. But the moment they start going from 9 to say 8, the doctor will be all alarmed, and she will it's just about creating fear in the mother. So if you say that, now this has happened with just one of my clients who is doing my classes with me, and the doctor said, I'm suspecting IUGR and oligohydramnios. And she is barely like 28 weeks. And this is based on just one ultrasound. And she's a very small lady. Okay. She's really, really tiny. And I don't expect her to even show that much belly. So she was asking me that I don't want to take another ultrasound. Can I refuse, or it is going to put my baby in danger if I refuse the second ultrasound? So so these are the kind of questions which I don't know what to answer.
Interesting. Yep, yep.
How would you answer this? So what I told her was, see, even if it is IUGR, whatever it is, you cannot base it on one ultrasound, first of all. Second of all, even if there is, you cannot do anything till the baby has reached maturity, till 36 weeks. You just have to wait for the baby to grow. So just eat good food, be stress free, and just relax. And if you really strongly feel that you don't want an ultrasound, you can always decline the ultrasound. It's not that you have to take it. So she is also put on the arginine supplement and asked to take lot of fluid and to have a repeat ultrasound after 15 days. So this is what the doctor has suggested. So I don't know what he is going to do if in the second ultrasound the AFI is same, or if he sees the growth is also similar. I don't know what he is going to do. It's not that you can prematurely deliver the baby. It's not safe either.
Yeah, again, it just goes to show, in my opinion, if it isn't broken, don't fix it. This is why the World Health Organization gave the recommendation: do not offer routine ultrasounds. Do not offer routine ultrasounds. World Health Organization. Don't do it. Why? Because you're going to keep finding problems that don't exist. And now, I mean, all these classifications and these that don't mean anything. Here you've got somebody reacting to, what did you say? Classification? Is that what you call it? Classification of nine or call it?
Yeah, AFI index of
Index.
index.
And then somebody else is saying 0 or 3 or 2. So this is a huge range. This is a huge gap. So
Yeah.
somebody else is going, 3, 2, 1 is nothing. And somebody is throwing panic at 9. So I'm a little confused.
Like Tapasya said that polyhydramnios is after 25, and I had a client who had 21 and she was diagnosed with polyhydramnios, and the doctor was eating her head to get it diagnosed. He did tests almost worth of 20,000 rupees on her, including a lot of rare genetic analysis and blood screening, and God knows what he did, because he wanted to figure out why is she having polyhydramnios when her blood sugar levels are normal and she does not have gestational diabetes. It was such a hilarious thing. I mean, I was sorry for the mother that she was going through all these things, but honestly, I didn't know what to tell her.
It
Just don't go to the doctor.
Oh
I
no,
have
she
to,
had a birth with him, at the end. But then it was after all this drama that happened for almost good 4 weeks. It's crazy.
Kale, your headphones. Kale,
yeah,
yeah.
I muted because I was yelling at my grandson to light some coils. The midgies are biting. Yeah, no, I was just telling him. No, but again, it comes back to, it seems to me over and over and over, where I thought in the 80s and 90s things were progressing, that we were stepping back from over medicalizing and over terminologizing, making up words, confusing people, over diagnosing things. I thought we were getting away from that. But it seems like it's 100 times worse. And the results and the outcomes are exactly as predicted. They're worse. Okay, give me another one and just bring it and I'll break it open for you. So it just proves the fact that as don't look too hard. Don't run so many. If you routine tests, you keep looking for things, you're going to find problems. Now, I mean, to be honest, I do certain things. I do. When a woman comes to me, I ask for a complete blood workup. I just one time, so they'll go in and get a CBC here, and then every time they come and see me, I'll do their blood pressure and do a dipstick with the urine and things like this. I feel these are easy, mellow, non-invasive. But I don't go, and just stays simple like that. It doesn't, this whole thing and this whole drama, and really this is what we're talking. Every week we get together and I hear all these dramas of things that don't exist. And the real concern I have is the fear that is being drummed into these women. Fear. And yeah, you can feel it. You feel it when you get together with people, when you sit down with families. Even if they're coming to you because they want to get away from the doctor, because they in the hospitals, because they know they don't like what they're getting fed. But the fear, nonetheless, the fearing has been effective. They still are scared, even if they don't want to be. And what's the answer? Education, I guess, is the only thing. Yes, I try to get them away from doctors as much as possible, or do try to encourage more home births, or at least make home births more available so that they become more promoted as such. Have a look, you'll have to walk around, and some are in my bedroom. if you are in the hospital, we need antenatal classes. That's a really good thing to be able to promote a new type of awareness. Does there need to be some sort of campaign throughout the hospital system? Maybe, maybe. I don't know. How far do you want to go? How much energy do you have? Because, because, yeah, I think it's alarming to me, and it's just going on and on and on, isn't it? Yeah. As far as I'm concerned, there's oligos is not a problem unless there's a problem that came with it. Meaning, is the woman under stress? Is something wrong with her nutrition? Just do a checkup on the woman. Is she okay? Do a checkup on the baby. Is it okay? Give the mother the information. Let her make her choices. And again, I would use the guideline. If it's not going, go ahead and have the ultrasound. You can, only if it's going to change where you have your baby. If you determine that your baby does have a congenital disorder, where do you want to have that baby? The mother may choose to have it. It doesn't mean the baby's going to die. Have your baby, and if need be, we can see the doctor later. You know, and if the baby falls under stress during labor, transfer or give oxygen or treat, then treat for fetal distress. Don't treat for oligo. Does that make sense? Don't treat.
Yes.
There's
Yes.
no problem with oligo. Add fluids, do these things, check up what could be happening. Then treat a problem if you find one.
Yeah.
Yeah, that makes sense. And the same thing for the poly. That's how I feel about these things. And perhaps
Yeah.
just education into the hospitals. I feel it sure is warranted. That's all I can say. The medicals feel the medical world needs to be educated because this is ridiculous. I'm sorry, it's ridiculous.
It is. It is.
Yeah, I don't know what happened in 20 years. What happened? Women,
Funny.
you know what? We need to start delivering babies with USB ports, I think. If we can do this, we could solve a lot of problems or make more. I don't know.
Yeah, I have a couple of things to add. I totally agree with Shruti, because I've read a couple of Ayurvedic texts, and Ayurveda says when you drink a lot of water after sundown, your body tends to get diabetic because your body doesn't know how to process it, because water in the body is always processed with the sunlight, according to Ayurveda. And people and the urban women who are going to these private doctors who are overcautious, they are given all these things to do, to take a number of liters of water and sachets and coconut water. If you overdo it, anything in over any extreme is a problem. And drinking a lot of water, that too after sundown, even in pregnant women, can cause problem. So in Ayurvedic lifestyle, you're not supposed to take too much water after 7:30 p.m. in the night. Yeah, that is one thing. Secondly, there is a book called Business of Babies by Jennifer Margulis. I had put it on the group. There, she refers to a study which was done, that over-diagnosing these things, the iatrogenic stress that you put women in, it actually results in problems.
Yes.
Because your body and mind is so connected, and if your mind is stressed, your pregnancy is going to have a problem. Even if there is not a real problem, anything that goes on, it surfaces during labor. And in labor, if the woman is she hasn't done her inner work, that will surface and she will just give up and go to the doctor.
Can you please share
And
that study, Tapasya, if you
uh,
find it?
yeah,
Can you share that study?
it is in that book called Business of Babies. I have that the PDF of the book. I can share it with you.
Okay, okay, okay. Right.
And it is shown that if the doctors are putting stress in women after different issues, those issues will surface because the body thinks that there is a problem and it creates a problem. It's
You're
because
kind of
we are
telling it
strange
what to
animals.
do.
Yes, yes. So it is very true that the fear mongering is it has reached its limit, and there are people who are now realizing it. And again, it goes with the vaccines. The like women are almost forced to get their flu shots, their Tdap's. The Tdap at 28 weeks. I have known a mom, which is one of again my friends in the group. She has lost a baby to that vaccine. There are cases, but nobody is talking. Doctors are not talking about the risks of taking these vaccines in pregnancy. But that's again a different topic altogether. But this is the reality. If you are making want to make business out of everything, you're just going to ruin the earth. That's
Well, this is what we are seeing, and what's becoming more and more prevalent is the business of birth, and hospitals are becoming more and more. Actually, hospitals are a business model now. You know, originally they were quite charitable. They were about looking after people who are injured and ill, and you know, they came together and you looked after them. And more, it's become so clearly, obviously, a money-making venture, and the machinery and equipment is so expensive that they have to use these things. They have to justify the use of them and bring the money back in. Um, yeah, and uh, what to do? What to do? It, but swim against the current, I guess. That's what I would
yeah.
do. More home births, more birth centers, more. Yep, more education.
I wish Gauri was there. I really wanted to listen to her story.
Yeah, me too.
Is there a way to get her on?
Let me see. I'll send her a message.
Anyway, but yeah, we if we have time, we might as well discuss what we would like to discuss next.
Okay. Hang on, hang on. Okay, I sent her that message. Okay.
And I observed in that free birth group, people are not getting ultrasound. They are consciously choosing not to get ultrasounds. And I've rarely seen any problem related to amniotic fluid. There might be a
Or
problem with
anything.
science.
Amazing that.
How?
Because you stopped looking for it.
Yeah.
If you look for problems, you'll find them where they didn't exist. And so
Exactly.
at the end of the day, that's really what I think we have to say about it is that, or at least I have to say about it, is that neither one of them are issues to me, or are, sorry, what I would do and what I like to do if I was practicing and somebody presented with this. They came to me with a question. The doctor said this. Well, I again refresh my brain, um, and start presenting alternative information. If it's something that you see a lot, and you're telling me, sorry, you see oligo, or actually, it sounds like you see them both a lot. I would actually, if that's the case, I would have these handouts ready. I'd have one on polyhydramnios and I'd have one on oligo. And I'd have it up to date with a lot of options, including your Ayurvedic stuff, including, I would go right through it as if I was talking to you guys. This is what polyhydramnios really is. I might actually totally leave out the definition, ultrasonic definitions. I might actually chuck that right out. I'd have to refresh my brain and look in at it. But these indexes were not there before. These are a new modern adaptation. So I would go back to something a little more primitive. And because my intention here is to get them away from a reliance of these things. So this is, I would explain what it could be. I'd probably update them with the World Health Organization's recommendation towards ultrasounds. I would throw in what Anne Fry had to say. I would throw in what some medical texts had to say, because I like to keep things balanced. If you have the time and the inclination, you might go in and ask your local hospitals, what do you do about this? Or who are the people you happen to be dealing with? This is something I would have done. I know the doctors, I know the hospitals in my region. This hospital will do that. This hospital will do that. This hospital will do that. And this would be a handout I would give them. I'd be including alternative remedies. As you mentioned, not just homeopathy, but there would be, there's all kinds of things like massage or diet, et cetera, et cetera. So I'd be putting everything in, bang, bang. I'd have these all ready to go. If you're dealing with this kind of stuff all the time, that's what I would do. And at the conclusion for it all is, other than that, I don't have a problem with these things.
Yeah.
Okay. Shruti, is that okay? Do you have anything further to add to that topic?
No, I think that's it. I think what you said is like precisely that. So we can make a list of things that the mom can do if something does come up like this, and just reassure them that it's going to be fine either way, if other things are checking out. Yeah.
Exactly. Because you have to work with who you're working with, and you're not working with a free birther, you're working with these other women.
Right.
And they need your help too. They need your help too.
Yeah.
Okay.
I had a mom whose doctor had said that your AFI is 5 and you need a C-section immediately. And I said, no, you don't. She waited for 2 weeks more, had a healthy baby, and there was no problem. And she had a home birth. So I would never turn down a client on the basis of her ultrasound report just because she has been diagnosed with oligo or poly. So yeah, that is my stand.
Yep. Okay, so the next question I'll have is, has anybody had particular challenges this week? Other than the Ollie? Okay, I'll take that as a no. Why, you want to hear about my grandchildren? Okay, never mind. So sorry, what did you say, Tapasya? You wanted to talk about what we're going to talk about next week?
Yeah, just if we have time, we could discuss it.
Yep. What's next? I don't have any. Oh, okay. Hang on, let me open up something. Yeah, I'm just kind of I just kind of follow you guys. Okay, I'm just opening up my old thing, my list. Um,
Or we can take one of your stories from the books, your book.
okay, I'd have to look to find that book. Is there, now that we're mentioning it, antenatal routines and why?
Yeah, yeah.
So again, on my first visit, that's what I would do. I bring out my form. I think I sent you a copy. And the first thing on my first visit, I review the form with them. I go over it from the first page, and this was actually interesting for me that I had to change when I moved to India. So I explained to them, the first thing in the form, I'm getting their name, their estimated due date, and then I'll always ask them, how do you know? You know, the doctor told me, the ultrasound said that was the, first day of my last period, blah, blah, blah. And we go through that. And then the next thing, so I start covering medical history. And then I explain why. So I start asking the usual questions. Have you ever had asthma, TB, respiratory distress, rheumatic fever, blah, blah, blah? Now, normally when I ask these questions, I just go through it and there's no issue. People stop me and stop me if you have a problem. Stop me if you've experienced any of this, and they'll stop me. But that wasn't the case in India. I had a different experience, and I could see the women they kind of backed up. They did not like this question. And I saw it over and over. And I finally asked Siddharna, what's going on every time I ask this? I can see they're uncomfortable. And she said, it's because you're bringing them bad luck. Okay. So I never figured out how to get around that. If anybody's got some tips, that'd be good. But that was an interesting change. Allergies, injuries, hospital, all that kind of question. In India, I found some of these questions to be confronting. In the in the West, I have no issue asking any of these questions. Have you had any injury, surgery, or hospitalization? I have no issue asking the question. Have you had blood transfusions, gonorrhea, syphilis, or herpes, etc.? Whereas in certain places in India, these are not questions you can ask. And I think I stopped asking those questions. In other countries, they might be quite pertinent and relevant, and you need to ask those questions. Just have to see what other people's experiences are. Are you on medication now? So in India, that's an interesting question. Because if they've seen a doctor, they are. They've been given, oddly enough, as soon as they're pregnant, they're given antibiotics. They're given, what's the other thing? They're given iron. There's something else they're given, some weird thing.
Calcium supplementation.
Calcium supplementation, did you say?
Yes.
Yep. And
Folic acid till 3 months.
yep.
Folic acid, yeah.
Yes. So some of these things, the folic acid, I don't mind so much. Some of them I do mind because it just depends. Again, if you don't have a problem, don't treat it. However, having said that, there are some situations and places and neighborhoods where it can be an issue. Nutrition can be an issue. So nutrition, it just depends. And it depends what kind of nutrition supplements you're giving. Like there's a difference between organic based things and iron produced in a laboratory will be processed quite differently. So, but that's a funny thing that I noticed was that women in India show up on medication because, and that was prescribed just because they were pregnant. And they sometimes were disappointed with me if I did not prescribe something or offer them a pill, something. Um, and Savarna's joined us. And Savarna, I was just mentioning again. I'm just quickly kind of going over my form, just simply because we had time. And I mentioned this.
Again, I have a question which I forgot to ask.
Yep.
So maybe I can ask if that's okay. Yeah, I had two interesting moms. I mean, interesting in the sense I came across because I've never seen such thing previously. Last 4 months, over the last 4 months, one mother had cervical incompetency, previous miscarriage, cervical incompetency, was put on a bed rest till 32 weeks. She had a hospital birth, was under gynecological care. Then after 32 weeks, she was asked to move, do exercises, all those stuff to prepare for birth. But suddenly this mother around 36 weeks developed kidney infection. And interestingly, one more mother in just 1 month later, also she was healthy, she was doing all the exercises, very active, everything, but suddenly developed right side flank pain, and also diagnosed as kidney infection. But this mother, she was given antibiotic, and the pregnancy went on. She delivered normally. That is a different story. But I had a doubt, how come some healthy pregnancy, what is there is any, have you, any one of you have seen this correlation, anything like that?
So why was she on antibiotics?
Because of kidney infection.
Okay, sorry. So, but before that, she had the incompetent cervix. So, meaning, what does that mean to you? What does that mean in this case?
No, that one case, there are two different moms whom I have come across over the last 4 or 5 months, where I've never seen this kidney infection and pregnancy. And this mother had, because she has been lying in the bed all the time, maybe because of some pressure or something, at least all right, but still there is no thing to correlate with bed rest. I don't know what is the link. But the other mother around, she was very active, doing everything, perfect, normal, everything, was suddenly been diagnosed with kidney infection, was given, because of the infection, was given antibiotics later on. But she ended up with vaginal normal delivery. That's vaginal delivery. But have you, any one of you have come across kidney infection in pregnancy?
Yes. Well, you get urinary tract infections are quite common, of course. And of course,
Yeah.
a kidney infection usually is a follow-on from a urinary tract infection or a bladder infection that doesn't get resolved.
Okay.
And now normally, if you're seeing the woman, signs and indications will arise. For instance,
Okay.
you'll, for me, because I'm checking them, I'll notice blood in the urine, blood and or protein in the urine.
Okay.
Nitrates are showing up, and
Okay.
uh, things like this that are leaning toward infection or kidney infection. In addition, she's probably got a fever and just not feeling well. Now,
Okay.
urinary tract infection is one thing, bladder infection is one thing, that's that burning, horrible thing. Kidney infection, you are sick. You are sick. So, and usually it doesn't just come bang, it kind of develops. So my guess would be that this mother was lying in bed and just this kind of atmosphere could contribute to developing the kidney infection. Um, um, the other question about the cervix, is it about, so is that your question just about the kidney?
No, the kidney infection. Because one thing, okay, one mother was bed resting, but bed rest, most of the time because of cervical incompetency, incompetent cervix, whatever they say. But the other mother was active, was very active doing all the exercises. Maybe could be because of, as you said, because of urinary tract infection or bladder infection.
Yeah, usually, and it's kind of like this. And then the question of the incompetent cervix too. What they're
Okay.
referring to is a cervix that doesn't hold itself, let's say. Meaning that, so as the uterus grows, as the baby grows, as the amniotic sac starts to grow and apply pressure,
Okay.
an incompetent cervix is unable to stay closed. It wants to, with a little bit of pressure, it wants to expand and let the baby out. So I have seen this once. I've actually seen this once, in fact. And this presented itself at around 4 months. And yeah, the mother had to do, well, actually, I think they actually stitched her or did something. I don't know how they do this. And then she had complete bed rest up until 36 weeks, at which point they at this point they weren't concerned. Again, this is back in the 70s, so they weren't so overreactive. They were happy from 36 weeks on that if she had the baby, that would be fine. And she slowly, because she'd been in pretty much bed rest other than to have a shower and go to the toilet, she wasn't doing all that much even when she was allowed up. Took her a while to get her energy. And then she had her baby and no issue, no problem. And this is the only thing I know or see or have seen.
Okay. Thank you.
No worries. Okay, hang on. Oh, so Savarna, what I was starting to say was, I was just recalling that time, as I mentioned before, when I was doing questions, doing the antenatal record, filling in the forms with the ladies in the first visit. And I'd start asking their medical history. Have you ever had asthma, TB, respiratory distress, et cetera, et cetera. And I noticed that women started becoming uncomfortable. And I asked you about it.
Just before that, I would like to ask something that regarding the poly and oligo thing.
Yep.
So, do you remember there was a case when it was AFI was less than 5, and we didn't go, like the doctor wanted to induce, but we wanted to wait, and it was not in the case of MAP. It was just me and just a friend of mine, and we wanted to wait, and then she went into the government hospital. She was drinking, she was fine, but the next day baby died.
Next
What do
day.
you think? Yeah, next day.
Was I?
Like morning 4 o'clock, till morning 4 o'clock, baby was good. And when they checked at 8 o'clock, 9 o'clock, baby was no more. There was no heartbeat.
Was I
And
there? Are you saying, was I there then? I must have been.
no. Oh no, it was not in Mayapur. It was here.
Oh, okay. Okay, so
It's like, was it just AFI or just something else, or I don't know. I mean, they didn't tell anything because it was government hospital. And it was really bad experience after that. But
In what way? How was it a bad experience after that?
Yeah, they didn't treat women like very nicely. It was really bad experience after that.
Gotcha, gotcha. Well, this is part of the problem in my experience in India is that you don't get the answer, you don't get information afterwards, so it's hard to know, it's hard to comment. Um, and it's awful. Again, it's awful that women get abused and mistreated at such a horrible time. I just don't understand it. We have to save this. We need to save this. What is the reason for incompetent service? Um, yep, I'll get to that. So Savarna, she went in for an ultrasound, told the AFI was 5.
It was scanning.
Yeah,
Yeah,
and
ultrasound.
and then the doctor said you must. The doctor said what?
Doctor said she wants to induce,
Yep. And
and
next
then we
day,
said, "No, we want to wait."
yep.
And it was, I think, Saturday night, and then still next day, full Sunday, we were waiting. Then we were waiting till Monday, because the doctor said the pain will not start. But at the end of the Sunday, pain was started, and all whole day Monday was there, and whole Monday she was having pains like contractions, but not very strong, very light contractions. And Monday night. So it's basically Tuesday morning, 4 o'clock till 4 o'clock, the baby was fine. And suddenly at 8 o'clock, they said they don't find any heartbeat.
Hmm. Don't know what to say. So
Okay, my question is,
The mother may feel the movement, right?
Was feeling a movement till 4 o'clock. And after that, she was, because it was like 4 days, she was tired, she was getting sleepy.
Okay.
the pastor?
So it was between 4 to 8.
uh, no, there might be many reasons for a sudden death. We
Yeah.
don't know. Even medical science doesn't know. But my question is about inductions. I have seen doctors advising inductions for low AFI, for IUGR, or whatever reason. But my question is, if they are seeing that the baby is in some kind of distress, why do you induce and increase that distress? Why not, if you're that afraid, do a C-section or just wait? Induction increases the stress on baby, right?
Mhm.
Why do that?
I agree. It very rarely does induction make sense. I mean, here they have a concern, which is really just based on an ultrasound scan again. Um, and based on this concern, but Savarna, how many weeks was this, did you say? So I don't know if this baby was late or what, so other than, again, just being diagnosed, was that you,
Due,
Savarna?
yeah, it was more than 40 weeks.
3 weeks over.
More than 40 weeks. I think
Okay.
the Saturday, just 3 days more than 40 weeks.
Okay. So the mother was due. Okay. So again, without the ultrasound, without this definition, you've got a mother at 40 weeks. So, okay. Yep. Sorry, I don't see a call to induce, of course, because there's no problem yet. We don't have a problem. If there is, as Tapasya says, if the baby is experiencing stress, well, then putting them under induction will only increase the distress. I don't even know if it really being effective at all. And at the end of the day, it sounded all that it all kind of unfolded normally until the baby stopped moving. But I don't have any more. I can't see any other thing to make guesses with. I don't. There's no other information to guess with. If you know what I mean.
Yeah. So, but we have to make a call that if we hear of cases like this or babies dying at home, etc., is that going to change what we are doing? I mean, are we going to turn down women who want that choice of home birth only because of our fears that something might happen and we might get into trouble?
I haven't.
That's kind of the question.
No, I haven't personally. I actually, okay, I have turned people away. And I'll tell you who they were. One person I turned away because they were junkies. They were on the, I took them on even though they were on the methadone program. And I was okay with that, but I wasn't sure. And I looked it up and the whole thing was kind of, I didn't really like it. But okay, we discussed it and I supported them through it until, now one of the issues with methadone is actually it's more addictive to heroin. Our babies get very highly addicted to it and they go through withdrawals too. So what this couple did was they rushed through their methadone program and they got off it early. And to celebrate, they had some more heroin. And at that point I said, look, I can't do this. Number one, two of my brothers were junkies. So I know what in the 70s, you know, and this is when it was all becoming a thing and it became a problem. And so I have experience with junkies and I know you just can't trust them. At the end of the day, anybody who's an addict and a full-on junkie, you cannot trust them. And they will always lie. They will not take responsibility. And it's going to cost you. So I turned them down. And so they went to the hospital, they had their baby. The baby was addicted. The baby had to be taken off the drugs. And when they came home, I went to see them and help them out. And they said that they held a grudge against me because they didn't believe they didn't believe that I was concerned about their use of heroin. They reckoned I turned them down because I didn't think I was going to get paid. Yet there I was doing a free visit. I was doing a free visit with them anyway. But anyway, it's just an example of how I just don't trust these guys. They never take responsibility. And there's another thing that I didn't end up in court. Somebody else ended up in court. And I told her this was not going to work out. This was not going to work out well. She was telling me about them. She let me ahead of time. She was, you know, I want to talk to you about these clients I've got, and they're junkies. Don't do it. Don't do it. It's not going to come out well. It never does. Next thing I know, she calls me up into the hills to back her up at a birth. I'm sitting there and asking her questions. Wait a minute. Is this that couple we were talking about? I told you, don't do it. Sure enough, we end up in the hospital. She ends up with a cesarean. They blame her, Alice. They take her to court, and Alice tries to get me to go down the tubes with her. No, I told you don't do this. So that's my experience with that. And just quickly with the incompetent, what's the cervix reason for an incompetent cervix? That's a good question. I don't really know. A true incompetent cervix is floppy, weak. But it's more of a congenital thing. I don't think it's something, and I'd have to look it back up. You know, it'd be something I'd need to look back up and see what other reasons there'd be. And certainly I know there's an objection to the terminology. It's incompetent, but it's not doing its job. That's all I can say. I call that incompetent.
My best friend had it. My best friend had it. She was pregnant with twins. They had given her a circlage, that is they call to stitch the cervix.
Yes.
But despite the circlage, her babies came in the 6th month.
Yeah.
One baby didn't make it. One baby survived. NICU stay of around 4 months.
Yeah.
And then he was released. But I could see that she has a sister who is genetically impaired. Her mom was a very thin, weak kind of person. And she herself was very thin, very pale skin, pale hair, kind of. You can make out, the healthy people and the people who have some, you can define it, but you can say there is some deficiency.
Yeah.
So I have seen cases of incompetent cervix in mostly malnourished people, and maybe they are from well-off families, but still they have some problem that makes their bodies not that as vital and as strong.
Indeed, vital.
Yeah.
Indeed.
And there is, and in India you will see particularly women in that type, because in some families female children are not desired, and just the feeling that this is a female fetus right from the birth, it impacts their development.
Absolutely.
So in poor families you will see malnourished girls who have lacked good nutrition right from their menarche. So yes, incompetent cervix can be a problem. I have seen real problems with it. It cannot be corrected in a pregnancy, but you have to take care of girls right from the puberty and even before that. So, yeah,
I have to agree.
kind of thing.
Okay, well, thank you very much. That's our time tonight. Today. We'll be back next week, and you can throw out what ideas and topics you want to discuss. Yeah. I'm always ready to go with the flow.
Okay.
Okay, I'll see you guys next week.
Okay.
Thank you so much for coming.
Thank you,
Thank you,
Gail,
thank you.
Taksya, Niroshan, Swarna. Bye.
Bye. Thank you.
Bye. Thank you.